Here at AACT, the Medical Academy will take part in a simulated catastrophe. However, no student is aware of what the catastrophe will be or when it will be. We'll see how well they handle it.
So MCI is a mass casualty incident, which means that it's an event that occurs where there's multiple patients, so more patients than there are resources. Usually it's about 8 or more patients, but it can be upwards of hundreds to thousands of patients.
Okay, it's Thursday. Everybody's preparing for this situational terrorist attack, and the medical kids don't know what's going on yet. Everybody's setting up. We have about 20 people in this room, and they're all injured by an anthrax bomb.
So the event that we chose was a Pitbull concert where there were anthrax bombs that went off during the concert, and then there was an active shooter outside.
What's your situation?
So I am dead, missing head, and I have no pulse, so pretty much a goner.
What are your injuries?
I'm complaining of pain when I'm breathing, and I have inhalation burns.
How do you think they're going to treat you?
I honestly don't know because it says I can't walk.
Medical students guided patients that could walk and carefully carried patients that couldn't. Patients were brought to an area where they were then triaged based on their severity of injuries, red meaning critical condition. After triage, patients were directed or carried to their respective treatment area. The overall process from acquiring, triaging, and treating every patient lasted about an hour. How do you think that went?
I mean, honestly, at the beginning it was like kind of fine because there was like one red coming in at a time, and then towards the end there was just like tons of reds at the same time, and like there's not that many of us here, so it's kind of hard like keeping track of everyone, but I think we did pretty good. Pretty good.
What was your main job here? Did you stay in this red station the whole time?
Just kind of like treating patients that come here and kind of getting them transported, like keeping count of how many people are here, how many people are transported.
Well, that seems like the hardest part.
Yeah, it was stressful.
Although the Medical Academy students may have been stressed in the moment, they proved that they can handle a mass casualty event.
Unfortunately, in the world that we live right now, it's not, attacks are like if it's going to happen, it's when it's going to happen. And so by having the training that these students have, they will be able to respond and help if there was ever an incident that occurred here. They would be able to jump in and help and know exactly what to do. And so that's why we do these simulations, is to better prepare if this was to occur.